I'm Jordan, a nursing student. Can I get your SBAR report?
Hi Jordan, my name's Chris. We have a patient named Greg Lutz. He's a 67-year-old male, patient of Dr. Phillips. No known allergies, he's a full code, he's allowed activity is tolerated. He was admitted to us for a stage 2 diabetic ulcer on his right heel. He's had it for about 3 weeks. It's not healing, and we're caring for it by cleaning and irrigating with normal saline and covering with dry sterile dressing. We're doing that 2 times a day until he's able to see the wound nurse. As a secondary diagnosis of diabetes type 1, his last blood glucose level was 242 milligrams per deciliter. Last oral intake was 4 hours ago. We're checking his blood glucose levels before meals and at bedtime. He reported that his glucose levels were above 300 consistently for about 5 days. Last A1C was 5.2%.
So are we going to be able to use that camera?
He doesn't have any abnormalities, no chest pain, no abdominal pain. Good range of motion. Pulses in all extremities. Good range of motion. Doesn't complain of any polyuria, polyphagia, or polydipsia. His blood pressure is 128/70. O2 sats 96%. Heart rate 76. Respiration 16. Temp is 98.4. He's got an IV in his right forearm. He's on a diet of 1,800 calories for diabetes. He's allowed 2 grams of sodium. We're checking vital signs every 8 hours. He has a CBC and a metabolic panel due in the morning. We need to obtain an A1C and urinalysis stat. He's asking for diabetes information for his diet, and probably recommend him to a nutritionist. He said he's been non-compliant. Do you have any questions?
Yes. Why specifically is this client receiving this medication?
The medication is for management of his type 1 diabetes, which means he's unable to produce any insulin in his pancreas.
What action does the medication have on the body?
Insulin lowers blood glucose levels, stimulating glucose uptake in skeletal muscle and fat, inhibiting hepatic glucose production.
When should you question administering this medication?
When the patient has any signs and symptoms of hypoglycemia, infection, or stress, also with renal and hepatic impairments, it should be used cautiously.
Does the medication have a therapeutic serum level?
You would monitor the A1C levels. Below 7% is reflective of good diabetic control.
Which vital signs must be monitored?
You want to check the blood glucose levels.
Which physiological parameters should be monitored when the medication is being administered?
Look for anxiety, restlessness, cold sweats, chills, cool pale skin, tachycardia, and drowsiness. Signs of hypoglycemia.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
You want to assess for or advise them of signs of anaphylaxis, difficulty breathing, as well as hypoglycemia that I already mentioned.
What interventions must be taught for taking the medication safely at home?
And make sure that you rotate your injection sites, that the patient is eating within the hour of medication administration, demonstrating the proper technique for the client, proper testing of serum glucose and ketones, emphasize the importance of compliant nutrition and exercise regimen, and educate on signs of hypoglycemia.
What are the side effects and potential adverse reactions?
Lipodystrophy reactions can happen if not rotating the injection site. Some others would include pruritus, erythema, swelling, anaphylaxis, and of course hypoglycemia
How will you know the medication is effective?
when the blood glucose level decreases.
Okay. That's it.
Alright. So we're gonna pull our insulins. Patient has regular insulin and NPH due this time, so we're gonna have to draw both of them. Gonna check it with our MAR and the pharmacist, make sure we have the correct dosage. Check the sliding scale. Sliding scale indicates that we give 16 units of regular, and he also has the 20 units due for the NPH. So.
Okay.
How you doing? My name's Chris. You Mr. Lutz?
Yes, sir.
How are you doing?
Good, how are
You
you?
feeling okay?
Yep.
Fantastic. Can you tell me your name and birthday?
Greg Lutz, I'm 67 years old.
Okay, confirm that in the computer. Greg Lutz, 76. Do you have any questions about the insulin therapy we're going to give you today?
No.
No? Do you understand the signs of hypoglycemia and anaphylaxis?
Yeah, if I'm feeling restless or,
Weak,
yeah.
drowsy. If you have any chills, shortness of breath, if you notice any mottling on your skin. What do you normally give your insulin?
My abdomen.
Alright, we assess the site, make sure that's okay. Hand hygiene. So you've got both regular insulin and NPH due. We're going to get that sub-Q in your abdomen, okay?
Okay.
Confirm my medications in the computer, confirm dosages. Have a nurse assist to confirm dosages. Can I scan your armband?
Mhm.
love
So
his
we're going
tracks.
to do
He's having blood glucose
20
checks before
of the MPH.
meals and
Make sure we
bedtime.
roll that.
And he's having
20 of the
blood
MPH.
glucose coverage
So we want to
according to a sliding scale. So we're going to give
insert
him
there into the MPH.
NPH insulin as well as regular insulin today.
Let's go.
And the
We're going to do 16
NPH
units.
insulin is 20 units, and then
Regular insulin.
based on the sliding scale, depending on which blood glucose.
So insert
Now, his
there.
blood glucose level is 242, so because of that,
Draw
we're
16
giving him
units.
16 units. Let's see, he's under, he's on a wound care protocol to clean and irrigate
Draw.
the wound with 0.9% normal saline and cover with a clean, dry sterile dressing.
20.
He's a non-smoker. He only drinks 1 16-ounce beer a week. He said it only.
Recap. Out my hand.
Vision problems. He has no vision problems.
Confirm
when he
dose.
goes to classes.
Mhm.
Nurse assistant.
Tingling in his bilateral extremities, which has been worsening in the last 3 months.
Reconfirm.
He's had diabetes for over 20 years.
Dose in my computer.
Blood glucose levels have
I'm gonna
been
check right
controlled
patient,
well with,
right
insulin
dose,
use,
right time,
until recently, for the last
right
5
route,
days, he's been getting up to
and right
300,
medication.
which is pretty high. So 3 months ago, he had a A1C test done, and that was at 5.2%, which is a good number. That's a low number. Normal
I'm gonna
range
cleanse
is
my
anywhere
site.
from 5.7. So that is a sign that the insulin treatment is taking up until then we're working well. Yeah, he had a transmural prostate recession 5
You
years
ready?
ago. That doesn't really have any relevance to the diabetes. His activity level is tolerated. His diet, he's on an 1,800 calorie diet and a 2 gram sodium restriction, which is very good for diabetes patients. We are checking his vitals at least every 8 hours.
We're going to assess your blood sugar
Yeah, so he should get
in a little bit to see if the insulin's taking effect.
And urinalysis soon.
And
He has been
just
on,
want you to try and monitor for the signs and symptoms of hypoglycemia. Can you tell me what they are that we discussed in
Restlessness, weakness, sweating, chills.
Have your call button.
Sure do.
I'm going to give you some information on the diet that I'd like you to read over if you can.
It's
Talk
because
about
he's a type 1 diabetic. And,
getting you to a nutritionist so they can
glucose is at 242. What the insulin will do is it should bring your blood glucose level
get you in
down.
track. All right. Do you have any questions about the diet?
No, sir.
What it does is it takes the glucose that's in the blood and it helps to put it in the cells and it basically stores it. If his blood glucose level is already within a normal range, then there's no need for the administration because that could drop his blood glucose too low.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
I had to check the
You want to keep an eye out
right
for,
patient dose, medication,
any signs
right
of,
route and time,
hypoglycemia,
and I was
just like confusion.
sure to
But
check the
until then, you
expiration
don't
date
monitor any vital signs.
before administration,
Except for you
and I
can
also wanted to
monitor
check the blood
hypoglycemia.
glucose and potassium.
Did this information affect your decision to administer the medication?
Yes, you don't want to give it. You don't want to give insulin if it's
Any kind of confusion.
less than 70,
And-
the blood sugar.
Did this information affect how you administered the medication?
Well,
Yes.
there's certain things that are important when administering insulin because it's a shot.
Why?
You are penetrating the skin, so there's a risk for infection. So you want to make sure that the vial is clean as well as the injection
Especially with the
site, alcohol
regular
swabs.
insulin,
You wanna
it
make sure that
depends on the
there's not
dosage,
abuse.
the level of
And it's
the level
also
of the blood
important
sugar.
to rotate the site.
Okay, that's
the
it.
sliding scale.
Fatty